This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, welcome to a new edition of Behind the Headlines. I'm Maura Donley, an associate of the Susquehanna Valley Center for Public Policy. And our usual host, Charlie Greenwald, is on assignment. So I have the privilege of having with me today Jere Strittmatter, who is a board member of the Susquehanna Valley Center. Welcome.
Thank you very much.
Thank you for sitting in for Charlie today.
I'm looking forward to it. I always like learning more.
I hope you've had a great summer.
Yes.
We are just winding down, starting up our fall season, and what does that mean? That means it's back to school time. So we have a really good guest to join us today because it is back to school time. And we're happy to have Ken Mash with us today, who is the president of APSCUF and a professor at East Stroudsburg. Welcome.
Oh, it's great to be here again.
Well, we have you on as a guest all the time, and we really enjoy talking to you. But I thought we'd start today with tell us about your organization so we can set the stage for our conversation today about tuition and access to schools and all those great things.
Sure. My association, the Association of Pennsylvania State College and University Faculties, represents the professors and the coaches at the 14 state-owned universities. So that includes universities like Shippensburg, Millersville, Kutztown, and on and on.
And ones that we're all very, very familiar with.
Yes.
So it's time to go back to school. It's time to pay tuition. It's time to get a degree, start college for many kids. But access to higher education is becoming tougher and tougher. And so we're gonna talk a little bit about some of the studies that have been done recently. But I want to ask you about the studies in general. What surprised you the most that you learned from that? You live this every day. What did you learn from those studies?
Okay, so first of all, I want to say that it's the beginning of the year, and I know that the faculty at all of our campuses are very excited. They start each year. We're in a very fortunate position, our coaches and our faculty, in that, every semester, every time we come back to work, it's a new, fresh beginning, and we have an opportunity to influence lives, and we think that's extremely important, and we are very proud of our students and what they're able to accomplish. Now, we've had several studies that have gone on this year. One was a study that was done by an outside organization which examined the state system, and they were trying to make some recommendations to improve the sustainability of the system. Our concern, though, really lies at the beginning of this semester with the studies that were done by the Pennsylvania Budget and Policy Center, which talked about college affordability, like you mentioned. Mm-hmm. And they did a series of 3 reports. There's one more report that they're going to be coming out with, which talked about everything from the fact that our universities do a good job of taking students from the bottom 60% and moving them to the top 40%. And we've historically done a good job at that. But we have seen a decrease in the number of students that we are getting from that bottom 60%. And their assertion is, based on the data, that that's largely because of the cost of higher education. What we're experiencing, what Pennsylvania is experiencing, and what's been going on around the country too, is that higher education has become more and more expensive. And we're in a situation, and I think it's largely because of state funding, and I know there's a lot of, there's a lot of organizations around who believe that there needs to be more funding. But we're in a position where in 2011 there was an 18% cut to the budget of the state system of higher education. We've had in the last 3 years small increases in our budget, but before that there were flat budgets, and we're really at a level for 1997 funding. So we're on par with 1997 funding, and that's a situation that makes it very difficult, and the only response really that the universities have to make up for that money is to push it onto the students, and that's what's causing it to become more expensive.
Yeah, that's really important because for the whole economic engine of the Commonwealth, we count on the university system of Pennsylvania, with all our 14 institutions, because those students stay here. We need them to be lifelong learners. We need them to be those upwardly mobile students. And with that concern, are the communities working with you, looking at this as well? where each of our institutions are located, because we have it throughout the state, some more toward urban areas, but others in the rural areas. Have you found that all works well?
Yeah, I think that's one of the things that actually the state system needs to do a better job at, and that is to reaching out to the communities, even the local business associations that talk about how important it is for them to have both, not just the university as a driver of the economy in their region, but also to supply a workforce for them, and also to keep their communities running. In the last of the reports that was done, they talked about the fact that when you look at Mansfield University, which is in the really up north in Pennsylvania, and you look at California University, which is out west, Edinburgh, which is out west too, and Clarion University, that those universities are struggling at this point, but it almost becomes a self-fulfilling prophecy, because if those universities are not going to be there succeeding, they're not going to be helping those students get a better education, providing an opportunity for businesses to move there and for those places to flourish. So it's a very complicated picture that's about, not just about the individual students, but is also about the overall Pennsylvania economy.
Right. And just as a follow-up to that, you as faculty have to work with that, and it's unique in the fact that you have students that are going back to relearn, you have students that are working and going part-time, but one thing is they're all in the community and they're going to be staying in the community, coming back and forth. How do you address that as faculty? Is that a lot different than your colleagues in other systems? With the student body that you have that's going to, or Pennsylvanians for the most part, that stay here in Pennsylvania? Sure.
With our students, we are, as you had mentioned before, we deal a lot more with students who are going to stay in Pennsylvania. We tend to have more first-generation college students at our universities too. So we do have a different student population. But one of the best things that came out of that NCHEMS report that was done for the state system was that they pointed out that Pennsylvania has a very high percentage of people over the age of 25 without any kind of college degree. And they said that the system has to do a better job, Pennsylvania needs to do a better job of reaching out to those people who are already in the workforce to provide them opportunities. And I think that that's something that's exciting that came out of that report.
Let me ask you something from a faculty perspective. If there's a prospective new professor and they see that we are 47th out of 50 in funding per capita, in the nation, does it make it hard to attract faculty to these universities?
Yeah, it's not just that. We have universities that are looking, as we speak, at reducing the size of their faculty, so laying faculty off. So when you start doing that, that raises a real concern about trying to attract people to come to the university, because that gets into the news, and frankly, we've had a lot of negative news, far too much negative news, because we do a lot of great things. But that does become a problem, both in terms of attracting faculty, but also in terms of attracting students.
Yeah.
And as the expenses have gone up at our universities, we find that the cost of going to our universities is creeping up to the cost of going to private universities. And that is really, it tells you just something is wrong, because our universities are supposed to be those that give a helping hand to the people in the working class to help them move up. But if our costs are going up, we're necessarily excluding students from opportunities to achieve the American dream.
So at the time of the airing of this program, we don't yet have a finalized state budget. And there is a slight increase proposed in the budget for higher education. I think it's 2%, is that correct?
It's 2% for the state system.
2% for the state system. That doesn't do a whole heck of a lot, does it?
Well, I don't want to.
It's better than nothing.
I don't want to look a gift horse in the mouth, because we're in a position where we are getting an increase, and really there have been no other increases proposed. But I think that's somewhat of an acknowledgement.
So we want to stay under the radar on that one.
Well, I don't know if I want to stay under the radar. We're appreciative of that, but I think that we are in a crisis situation as far as higher education in Pennsylvania. I think for students, the cost is getting really out of control. This is something that has to be paid attention to. We have students at our universities, which are supposed to be the inexpensive ones, running up debt, $35,000, $40,000 in debt. That means when they graduate, they're not putting money back into the economy.
No.
They're giving that money back to banks to make money. This is not just an issue that impacts those individual students, and it does impact those individual students. It also affects the entire Commonwealth.
We should make that point more with parents, because that just means the kids will stay home longer after they graduate.
It's so great to have you here today.
We have to mobilize the
It's so great
parents.
to have you here today because our show, as you know, goes all across the Commonwealth. And so as people see this, now they'll know that there's a great opportunity that maybe they're missing by not looking at our 14 institutions, our 14 universities. And is there the best way to attract that or to see where that is? I know there's a website for that, but as far as the faculty is concerned, is there maybe a better way that we could be doing that to make sure that everybody in Pennsylvania knows that we have a great resource here that really has openings and can really do great things for everyone?
Yeah, I'm really glad you said that, Jerry, because even amid all the financial troubles that are going on, and even with expenses growing, our universities are still the most affordable option that are out there, and they still do a great job. And we're even awarding more degrees now than we have ever before, even though some of the enrollments have gone down. We have great faculty, we have great staff, and great administrators at our universities. And you're right, they could go to PASSHE, PASSHE.edu and get a link to all the universities that are out there. But I would really encourage people to not just look at the university that's directly near them, but also to look across the Commonwealth at all those fantastic universities that are out there and the various different options.
Right, and also, I know when my children were looking, it was very helpful, and I'm sure you're going to say yes to this, but the faculty is very open to work on the internet with prospective students, either in the workplace or in 9th, 10th, 11th, 12th grades, and develop a relationship and understand more what's going on, and build those relationships, that can continue.
Right, and the faculty generally, all of us are very excited about opportunities to work with students. So that is what we do. That is what we believe. We want to make an impact in students' lives. We want them to think critically, be great citizens, and yes, we also want them to get good jobs when they graduate.
Okay, well then, all viewers, make sure that you go to that site and take a look at what all the universities are doing, because there's a lot of exciting things that you could get involved with.
Absolutely.
Let me ask you one last question before we go. It always goes by too fast, but how are these most recent reports, including the previous report, how are they being received in our General Assembly that would be really the ones that would be making some decisions on your behalf?
I think that we've got pockets of people who are starting to understand the situation. As always, politics gets involved, and some people are more interested in, narrowing things down and saving money that way. Yeah. But I think more and more people are starting to understand that we need to do something, not for the sake of the universities, but for the sake of the students and for the citizens of Pennsylvania, that their kids and they can have real opportunities to do well.
Well, Ken, we really want to thank you for coming to see us again. We always enjoy having you here to talk about the issues and the challenges our state system is facing. So we want to thank you for being here.
Thank you both.
Thank you.
Very good.
Thank you very much.
Thank you, Jerry, very much.
Thanks.
And we will be right back with another segment of Behind the Headlines.
Behind the Headlines is brought to you as a public service by the Hospital and Health System Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Welcome back to a new segment of Behind the Headlines. On this segment, Jerry and I are joined by Andy Carter. Welcome, Andy.
Thanks so much, Maura. Thanks, Jerry.
Andy is the president and CEO of the Hospital Healthsystem Association of Pennsylvania. And we've had you on before, and we spent a significant amount of time talking about the opioid crisis. And we're still talking about it because it's that bad, and it has not gotten any better.
It's a staggering problem.
Right.
You know, two things. The numbers tell a stark story. 4 times more people died of drug overdose than died in traffic accidents.
Oh my
That's
gosh.
how huge a problem it is. And it's particularly acute in Pennsylvania. The rate of drug overdose death in the Commonwealth is twice the national average. So it's drawing national attention, not surprisingly.
Well, we used to always say everybody knows somebody or has been affected by cancer. Now it's getting to the point where everybody knows somebody or knows somebody that's been affected by the opioid crisis.
Yeah, how could you not know someone when you look at the numbers?
Oh, it's frightening.
And it goes beyond. I think many people might associate drug problems with urban centers, but this is a crisis that's cutting across the entire Commonwealth. One of the more compelling examples of that is in the 3-county area of Clinton, Tioga, and Lycoming counties. In a 48-hour period earlier this year, 50 people died of drug overdoses. And one of my member hospitals, Williamsport Hospital, part of the UPMC Susquehanna system, in one 24-hour period, 36 drug overdose cases presented at the emergency department.
That's
These are staggering
yeah.
numbers. Yes, we have to get on top of it.
And as our viewers should know, this starts, not because of a drug dealer or whatever. It's because somebody has pain. And someone went in, they needed an operation. They were, like you talked about, car crashes. They're in a car crash. In order to heal, they needed a painkiller. And so the unintended consequences of that has been that these painkillers have rearranged our brains in a way that have us very addicted.
Jerry, you're doing a great job of reminding everybody that the face of opioid addiction and substance use disorder is a very familiar face. Our moms getting hips replaced and then ending up, as you're describing, on painkillers for too long. They're injured workers who are on pain medication for an injury they sustained at work who end up being addicted. And it's heartbreaking also when you think about the kids that are affected. Babies born to addicted moms who are in turn addicted. And then we know that
Children who see their parents overdose. I mean, they
do, and then they end up being removed from the home. In fact, 80% of kids being taken away from their parents it's because of drug addiction problems.
But how do we get from over here where people are using it to alleviate pain to people are accessing it just because they want to try it and they overdose on it? I mean, how does that transition occur?
The body just transitions.
Well, we know that we have to partner with many stakeholders, starting with physicians. We have to work with the physician community to help them keep track of the correct prescribing guidelines, not prescribing too much and not prescribing too little for pain relief. That's a huge part. We've worked with Governor Wolf and his team to establish Pennsylvania's prescription drug monitoring program that allows physicians, hospitals, and the Commonwealth to track doctor shopping and abusive prescription practices. We are taking steps at hospitals because we are the vortex of where this problem presents. We're trying to encourage communities to give back oversupplies of drugs. You go through your medicine chest and you find you have a 3-year-old Vicodin prescription that you once needed, but you don't want to have around the house. Bring it into the hospital. We have safe and secure drop boxes to get these things off the street. We have to partner with law enforcement as well. People are turning from these prescription medications. When those dry up because the doctor is doing the right thing, then they might find themselves in the illicit drug market. That's a huge tragedy. And we have to work with law enforcement, the Drug Enforcement Administration, to really get on top of that and shut down the supply and continue educating Pennsylvanians about how easy it is for any of the 3 of us to become addicted.
Yeah, and thank you and your association, because obviously you are the leaders in transmitting to everyone what the best practices are. What have we learned? How can we do things better? And so, is that working well for you? Do you need other resources in order to do that, or do you, as the association, have that under control and are doing well with that?
Well, it's pretty clear no one has it under control when the rate of drug overdose death is still rising. It was up 37% last year. But we do need resources. All of us in this need resources, supporting the prescription drug monitoring program, for example, but also supporting the very high cost of addiction treatment services. Give you an example. Vivitrol, which is a medicine that's used to help people recover from an addiction, costs $1,000 a dose. Now, many private insurance plans would cover that. Many people can afford it out of pocket. But many people facing addiction, their income is way too low to afford this, which is where Medicaid can come in. Oh. And Medicaid coverage has been a huge part and will continue to be a part of the strategy to end this scourge on public health. And we know Medicaid has been under some degree of attack. Mm-hmm. Recent congressional deliberations have suggested that we expanded Medicaid too much. I would argue otherwise. The 700,000 people that have been newly covered thanks to Medicaid expansion, many of those people are the ones that we want to help with substance use disorder treatment. We need Medicaid to be there as a resource to get on top of it.
Have you found, are there some hospitals that are, finding a way to substitute the type of painkiller, that doctors are using, and re-educating the doctors to that?
I think there's a wide range of strategies. I'm not a physician myself, so I'm going to be very careful not suggesting the particular strategies. But clearly, we are working with physicians and patients to make sure that people realize that pain relief has to be approached very, very carefully. And every discussion with a patient should remind them that short-term relief is what is sought, mm-hmm. but that we can't find ourselves getting prescriptions refilled time and time again, because that can lead right to the path to addiction. I think the education effort is huge. That's why I appreciate your interest in this program, to tell the story so that everybody can look him or herself in the mirror and say, am I at risk of this problem? That's a huge public service.
And okay, so let's say they do that. They look in the mirror and the answer is, I think I am. What should they do?
Talk to their physician. They should come to any healthcare practitioner, and we can help connect them with the counseling and the treatment services they need. But definitely, I recommend start with your primary care physician. If you don't have one, come to one of our member hospitals. We'll connect you with the treatment you need.
Just walk in anywhere and ask for help.
The healthcare community is increasingly aware of the need mm-hmm. for all of us to step up. So pretty much any healthcare facility, you can find help.
One of the last times that you were in, we were talking about this prescription monitoring program. It was not quite up and running. It sounds like it is up and running now.
It's up and running. 11 states and the District of Columbia were connected in. And there's more work to do. It's relatively new, but it is a resource available to all of us.
Do you think it's helping? I mean, the numbers are staggering, so it's not having a huge impact.
Well,
but will it?
Yeah, well, the hope is indeed it will.
Okay.
You start solving major public health crises. First step is to know the scope and the rate of incidence of these problems. And this database will help do that. And it'll identify relatively quickly those folks who are doctor shopping, and if there are physicians who are overprescribing, it starts to stand out pretty vividly in the data.
Now, I know that our president has come out and said that, this is a big problem. It's hard to avoid it. What sort of help can the federal government provide? What can they do? What are they going to do?
Well, certainly on the law enforcement side, the Drug Enforcement Administration continues to pursue effective legal strategies against bad actors, dealers, and the like. Certainly, the federal government needs to continue supporting the cost of all these treatment services, mm-hmm. because this is a disease, and it's important for people to recognize that it's a disease that can be treated successfully. Mm-hmm. So the federal government has its role to play in financing those costs. One of the impediments to aggressive government action in supporting treatment is the sense that Medicaid is a welfare program, and that it's not, we shouldn't be putting any more money into it. Well, as I said, Our own moms are all subject to the risk of addiction. Medicaid is covering a wide range of folks. You know, 2/3 of Medicaid spending is going to caring for older adults and people with disabilities. It's not a welfare program. And if the federal government reaches a clean and clear conclusion that that's true, I think they'll move more aggressively to support the funding we need for the treatment service.
For our citizens across the Commonwealth, and they have a problem where they have a loved one that has a problem, and with the different rules and regulations, the HIPAA rules and regulations, well, you can't talk about this and you can't say this to that, and then we have sort of bad behavior where people going to emergency rooms for things that they should go to get a Band-Aid for, and we have a problem there. What should our viewers say and do when they go to the hospital and say, hey, I've got a friend? How do they approach your members in the proper way to really have an effective meeting and outreach to that when they feel they want to do something for their relatives or for themselves?
I think it's through conversation, and we're all, as our healthcare practitioners, are trained to help encourage people to be more and more forthcoming. If someone comes in and is talking about a third person, then I'm sure what we would typically do is say, have that person come in. It's safe. We will protect their anonymity. They can be treated with privacy. The fact that they presented to the hospital or to the doctor for substance abuse treatment is kept confidential. Nothing's reported to law enforcement, so they can feel safe.
Would that be the registration desk of the hospital or the emergency room of the hospital, or that
I think
encounter? Where you suggest they go?
Well, I think just go to a clinical resource, whether it's an emergency department or your primary care physician.
Okay, so I want to make sure that we move from one crisis to another before we run out of time here, unfortunately. Hurricane Harvey, devastating to Texas and to parts of Louisiana. How are Pennsylvania's hospitals helping out in our last 30 seconds here?
In a number of ways. First of all, we're setting up connections to give donations, particularly donations to support hospital workers whose homes have been destroyed. We're also deploying staff to Houston. For example, our own Vice President for Emergency Preparedness is in Texas now as part of a national command response team, helping to address the huge recovery challenge facing us. And then finally, people are volunteering and going to Texas, nurses, physicians, to try to help out. Staggering problem.
Oh, it's only really beginning, even though Harvey has moved off, so it's going to be years.
Absolutely.
But we want to thank you so much for being with us today. We look forward to having you back, and hopefully we'll start to see the trend on opioid and just addiction in general go in the other direction.
Hope to bring back good news soon.
Okay, thank you. Thanks so much for being here.
Thanks, Maura.
Thank you.
Thanks, Jared.
Join us next time on Behind the Headlines.